Welcome to Basin Clinic in Naturita, Colorado, and my name is Pamela Stam. I'm a registered nurse and I am also the clinic manager here. This is the front of our building, which is a little outdated. We are in the process of getting some funding for a handicap ramp. We do not really have handicap accessible other than our ambulance bay, which sometimes can cause havoc if there's an ambulance in there with a patient as well. So, you come in here, you come into the waiting room. So this is our waiting room here. We are part of a reading program with the state, and this is some of the stuff that they've donated to us that we participate in. So when the kids come in for their child checks, they receive a book and they get to read, and it also provides us a little extra income. This is where patients, when they come into the front, they come in here and then they're checked in to this area over here where they're weighed and measured. The nurses then take all their information here, and then they're taken to a room. Our clinic, which is a little different than some rural healthcare clinics, we do take urgent care walk-ins. So we may have a patient load full for the day for our provider, but because we are where we are, we don't turn people away if they're urgent care, and we take them back and treat them.
My position is as physician assistant in family practice. I call it family practice with a vengeance. Again, the family practice is going to starts in the morning in the grocery store. Grandpa's sick, you won't come into the hospital or you won't come into the clinic. What do you do?
We accept everybody. We take everybody. We accept CICP. We also have our own sliding scale here at Basin Clinic. And so we don't cap the Medicaid piece of that. We want everybody to be seen. And that's part of rural health care, I feel like, is they are your family. They are your friends. And so no matter the need, the financial situation, the complexity, we're going to see you and we're going to strive to take care of you and make you better. I would say one of the biggest challenges is funding and trying to keep the doors open and keep our equipment up to date and keeping providers here, which also comes from funding. When a lot of patients got on Medicaid, it's great for the patient but not as good for the facility because the reimbursement is not there. So again, that goes back to funding of what's available to us. We want our clients and patients to be taken care of, but we still have to survive. And so that's a fine line for a lot of people.
As we are considered a frontier clinic. I don't know if a lot of people understand frontier clinic, but for those who do, you know what we're talking about, and for those who don't, you really need to come see it. That's it. We are on the edge.
Because if we didn't have this facility, the nearest hospital is approximately 2 hours away, and that would be devastating for a lot of people and life-threatening for people if we didn't have this facility.
From Paradox, our actual EMS runs go up to about 8-hour round trip by the time we get them picked up for what location we do. We bring them into the clinic, and then we have to transport them if it's Grand Junction or Montrose, and by the time we get them taken care of and come back, it's pretty close to 8 hours. So
If it's after 5, our patients have to call our local EMS, who then come and triage them, pick them up, either treat them if they can on scene. And it can be things as simple as they're not well or a small cut, and then if need be, our EMS then takes them on to the facility that they need to take them to care for them. We would like to become a 24-hour here at Basin Clinic, for the simple fact it is 2 hours for anybody to go for a small suture.
So when they're closed, that's a different story. We have intermediates and basic EMTs that are taking care of these patients that full run, and on medical directions, hard to do since our communications are really bad in this area. We rely on aircraft to come in, helicopter services and stuff. If it's really super bad and we deem it necessary to be flown out, we do have that option here. But we would rather see that clinic open and get our patients stabilized before we take them.
Let's see, the most challenging part of working here is probably the specialty care. So people will come in, and if it's just beyond my abilities, anywhere from appendicitis to back pain to did we have a stroke last week, any of that stuff, it is becoming increasingly difficult to get referrals. The specialists are very good. I sometimes say that my telephone's more valuable than my stethoscope.
Know what you're voting for. Really get down to the nuts and bolts and know what it's really like. Do you really know that employees are taking own pay cuts, that employees are buying their own things to come into the facility, that employees are donating back vacation time just so that their facility can keep a door open? So I think when legislature passes down rules and regulations, I think it's critical that they know how it impacts a rural health clinic, the rural health care period, that they don't know that these patients, if they couldn't come here, then they may die.
You can legislate a lot of things. Whether small communities can afford them is a different story. And that means you come back to the state and ask for grants and any money, federal and state as well, to have the money to do these projects with. And it's the only way they can exist, really. If you're going to put requirements on them that they can't afford to change to, then somebody has to help you. So that's been our case here for quite a few years.
The people that are here are, for the most part, just fantastic individuals. We're stubborn. We don't give up. That's, I think, why we're still here and still going strong, because we don't give up. We are definitely a group of persevering people.
People who live here are, by definition, very independent. We're 2 hours from the nearest supermarket, 2 hours from the nearest hospital. You have to drive through 2 counties to get to the next largest town.
So as far as the people that live here and the patients, the story that shapes me every day actually happened at the restaurant. I'm sitting at the restaurant and I'm listening to a conversation behind me. And one of the people is saying, I've been having chest pain. It's my heart attack. It's coming back. I'm having to use lots of nitro. And the other person says, why don't you go into the hospital? And says, no, because I'll lose my house. And this person said, someday you're going to knock on the door and you're going to see me on the couch watching TV, and the kids will get the house. It's sick.
Ken and the nursing staff that we have now, are all godsends. All. We wouldn't be able to do anything without them. And I'm all for rural care. I really am. And if it wasn't for this clinic giving me a life and a lot of others, we wouldn't be. So I'm thankful. I'm really thankful.